In this video, we're going to work on hip internal rotation. We're also targeting a little bit more of the sartorius muscle group that crosses the hip joint and also the knee joint. It's very common to get tight with a lot of sitting. So in order to target it, you want to get that hip, first you want to get in the 90-90 position. So forward leg is actually going to be the internally rotated hip. Your butt might not be anywhere close to the ground. That's totally fine. Be very patient with this and don't force this into any pain or anything that's uncomfortable. And I want you to lean your body back so it's not as intense, just so you can kind of ease into it and see what it feels like to get in this position. And what I want you to do to start is I want you to squeeze your glute, keep your knee and your ankle down on the ground as you bring this portion of your pelvis forward. So now my hips or my pelvis is squared in this direction. You should feel your glute fire quite a bit. Again, the knee is staying down, the ankle is staying down. And then you're going to go to try to touch the sit bone of your butt down to the ground. Again, make sure it's not too much torque on the knee joint. If so, maybe get a little bit more bend in the knee just so you don't irritate that joint. Again, trying to intentionally get that sit bone down to the ground if you can. Hold it for a couple seconds. And then again, segue, squeeze the glute, knee and ankle driving to the ground. Pelvis is going forward so it's squared in the direction of the externally rotated leg. And then you're going to relax the glute. You're going to try to get the glute down to the ground as close as you can. Don't force it. Keep this leg down. And then you're going to go back and forth between this for however many I prescribe to you. With time, you can maybe lean a little bit far forward with your torso. Maybe less hands will be supporting you as you actively go through those different ranges of motion. Again, this is trying to help increase some movement in the hip capsule with a little PNF strategy, as well as just trying to open up the hip joint itself. Maybe giving some extra traction might feel pretty good. So if you want to just try something different, hand goes in the knee crease and the direction of the push is in this direction. Very gently, so you have traction in the hip joint, and then again you go through, and then maybe focus more on getting the glute or the sit bone down to the ground when you're doing this traction.